Greetings, Pathos students, and welcome to our final week of content, week 12. If you are listening to this or starting to listen to this video and you have not yet taken course exam 4, pause this, stop it, go take course exam 4. The content of week 12 is not included in course exam 4. It is included in your final. So you need to be taking course exam 4 at the top of week 12. Integumentary system, the integumentary function, which is basically our skin. That'll cover chapters 45 and 46. This is, I want to say it's a short week related to content. Remember that our skin is our primary organ in our immune system. And if you ever have a Jeopardy question about the body's largest organ, it's the skin. It's considered an organ. So our first line of defense in our immune system is our skin. Chapter 45 goes over structure and function, and then 46 goes over some disorders. So what I'm going to ask you to do in chapter 45 is just take a look at the top of the chapter of the layers of the skin to refresh your memory, the superficial layer, the epidermis, and then the deeper layer underneath is called the dermis, and that consists of connective tissue. And then read about what are the functions of the epidermal cells. Moving through the chapter, I want you to be able to differentiate the sweat glands from the sebaceous glands. What is the function of the sweat gland? What is the function of the sebaceous gland? Moving on to some disorders that are generalized, I would like you to differentiate between a rash and a lesion. And unfortunately, there's no, there are plenty of pictures of disorders, but there's no one figure that shows you the difference between those two. So you'll have to read about the difference between a rash and a lesion. And then moving through, there are 4 types of pruritus. That's P-R-U-R-I-T-U-S, pruritus. 4 types. I'd like you to know that. And then that's it for chapter 45. In chapter 46, where we get into some of the disorders, I would like you to read about the various fungal infections. And here we start seeing some pictures of sometimes some gross stuff. But these are things that you will see either in a clinic setting or sometimes in a hospital. Figures 46.1 through 46.5 will show you a variety of fungal infections and what they look like. Moving on, the etiology and the clinical presentation and the treatment of impetigo, which is a common skin infection caused by staph or strep, and it's common in children. And also cellulitis. This book only gives one little paragraph for cellulitis, but I can tell you, maybe just from reading that, you'll get a sense that cellulitis can work its way into a very serious bacterial infection. And it is the reason for many people being hospitalized. If they don't respond to oral antibiotics within 3 to 4 days, or if the progression of the cellulitis is not stopped by those oral antibiotics, then that's cause for admission to the hospital for IV antibiotics. And it can get quite serious. Take a look at figures 46.6 and 46.7. That will be for impetigo and then cellulitis. Also here, the difference between herpes simplex and herpes zoster. So herpes simplex is what we refer to as cold sores or fever blisters. Herpes zoster has to do with that exacerbation of the varicella that is in many of us, either from immunization for chickenpox or from having chickenpox. Take a look at 46-10. That would be figure 46-10 for the difference, and read about herpes zoster versus herpes simplex. Also, I'd like you to read about atopic dermatitis, which we know as eczema. There's a small section that tells you about eczema and a figure 46.13 versus urticaria, U-T-I-C-A-R-I-A, urticaria. And if you look at 46-14, there's a depiction of urticaria. So what's the difference between those two? Moving on, drug-induced skin eruptions. The most serious that I want you to read about here is Stevens-Johnson syndrome. Remember that the skin is our most important organ of the immune system. And with Stevens-Johnson syndrome, I have seen patients who have to be admitted to the burn unit because they have lost so much integrity of their skin that basically their immune system is totally broken down. It can be fatal if it's not diagnosed early. So that's an important one for you to read about, Stevens-Johnson syndrome. Moving on, ladies in Arizona, men too, read about ultraviolet radiation. This is serious stuff. This is in the textbook. And what the effect of the sun has on our skin and therefore our immune system. Read about how UVA and UVB light will affect the integrity of our skin, the aging process, how sunburn is developed, and how then we go on to develop skin cancer from continuous and prolonged exposure to sunlight. Then I'd like you to take a look at the classifications of burns. First degree superficial, second degree, third degree burns. Table 46-1 goes over what we call the rule of nines, and that's how we estimate the survivability of a patient who's experienced burns, where we assess for the depth of the burn or the thickness of the burn, as well as the total body area that's been exposed. Then moving on to less dramatic is a pressure ulcer, but this can be very serious. Pressure ulcer basically has to do with ulcers that are formed over time over bony prominences of the body, and we see this a lot, unfortunately, with elderly patients from nursing homes who are not repositioned as they should be. We have a rule in the hospital where we say a patient must be repositioned at least every 2 hours, and that is to prevent what you'll see when you read about how a decubitus ulcer is formed or a pressure ulcer is formed. You'll see why that repositioning is so important. Take a look at figure 46-19. And then finally in this chapter, at the end of the chapter, it deals with skin cancer. So read about basal cell, squamous cell, and malignant melanoma. These are 3 categories of skin cancer. How do we differentiate them, and what is the pathology, what's the likelihood of metastasis, and the diagnosis and treatment of those kinds of skin cancer. And that is it for this chapter. So there's not much content to cover. You can expect to see a few questions in the final that have to do with the integumentary system. So if you have any questions, content, please email me. You can look for an announcement that I just posted in Canvas about your remaining exam schedule, so you can plan accordingly. Thanks.